It seems like we were just here a few months ago, and actually we were just here a few months ago for this very same program, but we're back again because we have some great news to share about our See to Succeed program. I appreciate all those who have joined me today. Very happy to have Senator John Whitmire. We're gonna slowly bring it down just a little. Everybody's excited. We have a lot of kids in the building. Happy to have Senator John Whitmire. Happy to have Dr. Greer of HISD, Stephen Williams of the City of Houston Health Department, and many of our community partners that I'm going to announce or discuss in just a moment. In order to succeed in school, children have to be able to see. They have to be able to see the blackboard. They have to be able to see the book that they're trying to read. It not only enables them to do well in school, but it also significantly enhances their quality of life in other areas as well. The See to Succeed program has been going on since 2007. And it is a great example of a public-private partnership, or I should say public-public, public, private, private, private. We have lots of partners. And this is truly a case where many hands sharing the load make the work go easier and make the benefit go so much farther. This program targets school children between the ages of 6 and 18 with vision problems that are identified in the schools and that are unresolved for a period of time after the parents are notified by school nurses of the need for corrective lenses. This program provides free glasses in a quick and easy setting. It's one thing to say to a parent, your child needs glasses, go find glasses. It's another thing to say to a parent, your child needs glasses, go find glasses, and here's some places you can go for help. But it's even better to say, your child needs glasses, we're going to take care of it because this is important for the child. Our See to Succeed partners include Essilor Vision Foundation, Essilor Corporation, Kids Vision for Life, Berkeley Eye Center, the University of Houston Eye Institute, San Jacinto College, One Sight Foundation, Walmart Corporation, and other community volunteers. Today you're seeing how the system works. Children are identified, parents are notified. If the issue remains unresolved, children are bused to a vision clinic site where they receive a free vision exam and a prescription for eyeglasses. And this is up-to-date technology. In fact, one of the ways that makes it work really well is that we do have, thanks to our partners, up-to-date technology and the kind of glasses available that children want. I started wearing glasses in middle school. No child wants to wear glasses, but if you want to see, you'll do anything for those glasses. But the difference between a really ugly pair of glasses that you get teased about and a quality pair of glasses that are the kind of glasses that your peers whose parents pay for those glasses have is immeasurable. This is not just a great program, but it gives children a pair of glasses that they pick out, the frames that they pick out, that they want to have, and that they can be proud of. Everything about this program is something that we can celebrate. Now, I want to invite some of the partners who are involved in this to come up and talk a little bit about what's going to happen. And Dr. Greer is going to make an announcement, which is why we're back here today. Dr. Greer.
Thank you, Mary. It's good to see all of you here today. Today it's my honor and just absolute pleasure to announce that after coming here a few months ago with Senator John Whitmire, They had me, John had me from day one. When I walked in, the first second I set my foot in here and saw these kids and saw how excited they were, I knew that this was a wonderful and unique partnership. And I asked John and I asked the folks here, what could we do to help? And they said, well, if we had a little more resources, we could see a lot more kids. And we have kids whose vision's needs are not being met. So we went back and we prepared a proposal to the Laura and John Arnold Foundation. And they very generously responded by donating $100,000 to this effort. And in turn, I went and talked to our school board and our staff, and we matched that $100,000 to our school district. And so we're very pleased to announce today that we are making a joint contribution supporting the Laura and John Arnold Foundation and presenting this wonderful organization with $200,000 to help support their vision screening. And as the mayor said, this is a wonderfully unique partnership. I know of no other like it in the country. And quite frankly, I think more school districts, particularly large urban districts, ought to be learning from and emulating the partnership that we have here. And I again want to say a very, very special thank you to Senator John Whitmire for bringing this to my attention. Senator is someone who cares about Houston, and he cares deeply about children and about the quality of education that we're working so hard to provide.
Senator?
Thank you, Mayor. I'll be real brief. This is why we are in the positions we're in, and it's great to see that the mayor is here providing leadership in her health department at this city facility. Dr. Greer didn't hesitate to join in. The public volunteers is, like I said, the reason that we're in the positions we're in, to make a difference. And this is certainly making a difference. And the exciting thing about this is, Mayor, you see the immediate results. The mayor and Dr. Greer and others of us study a lot of things. We have projects. Sometimes we get very frustrated. Sometimes it takes a lot of time. But the first time I saw this program, Patrick, was you get immediate satisfaction that you're making a difference that day. And because of that, I'm excited for the donations and also the challenge that we go forward. I think, as the superintendent said, Mayor, this is unique across the country for a city and a school district and volunteers to come together and put glasses on young people that were struggling in class because they could not see, and everyone did not notice. They will be noticed now. They'll be fitted for glasses, and we will see an improvement in their grades, which is a win-win for everyone. Thank you.
And I'd like to invite up Stephen Williams, who's the director of the City of Houston Health Department.
I'm not Stephen Williams, but he's asked me to speak.
All right.
First. Without Stephen Williams, we wouldn't be here today.
Introduce yourself.
My name's Joel Shannon. I'm on the board of the Houston Department of Health and Human Services Foundation, and my wife is also on that board. We went backpacking with Stephen Williams, and that resulted in me being here today and us involved in this project. Two things. One is the Houston Independent School District has not only given us funds that will help us see more children, they have also provided leadership in the school district from the top down to make sure that everyone throughout their institutions recognizes the need and has really enabled us to reach more children in the Houston Independent School District, and that leadership is essential. And we're trying to emulate that with the other school districts, and Dr. Greer has graciously volunteered to do whatever he can to help us. We really appreciate that. Secondly, there are other cities that are already recognizing what's happening here in Houston, Mayor. And through the Kids Vision for Life, which is a collaborative of eye projects for school children throughout the United States, we're communicating with people in other communities who are saying, how are you doing this in Houston? And Houston, again, is a leader, and I'm very proud to be a Houstonian.
Thank you.
Good morning. When this center reopened a few years ago, we knew that we wanted to make a difference in this community. We, in a partnership with Good Neighbor Health Center, reopened. They provided primary care. but we knew that that would only be the start of our doing things a little different here in Houston. This See to Succeed is an example of where we have brought together both public sector and private partners to make a difference. I'm really grateful for the superintendent for giving us resources to really expand our reach. Because the truth is that at the end of every school year, we know that under 18,000 kids in this region who needs glasses go without them. We believe that if we continue to pool our resources and that if we continue to have the level of cooperation that we've had from all of the people involved, that we can really solve that problem. I also want to give a shout out to my staff, Judy Harris, who really is responsible for the operations of this organization, because I'm not operationally oriented. I'm really am inspired by the leadership from U of H and the other institutions that have come together to really make this happen. And I know that this time next year, instead of talking about the 10,000, Mayor, we'll probably be talking about the 15,000 kids that we know that we can serve. Because we know that when children can see in school, they're likely to achieve higher grades, they're likely to not drop out, and that's what we're all about here. And that is making a difference in the lives of children so that we can improve the overall quality of life for those people who reside in Houston and the surrounding areas.
This is a great program. It's a program that we have been working on and improving, as I said earlier, since 2007. This contribution from the Arnold Foundation and from HISD, which would not have happened without Dr. Greer stepping up and taking this on, is going to make a tremendous difference in the lives of the children in our community. It's going to make us able to serve more children. And I think Dr. Greer would agree that seeing it for yourself was what made the difference. That this is a high-quality, very efficient operation, that we can handle a lot of kids very quickly, minimum out-of-class time. It's efficient for the kids, it's efficient for the schools, it's good, it helps the parents who could not otherwise provide these glasses for the kids, and the glasses they get, the kids pick them out. It's something that they want, something that they know that they need, and it really will transform their lives. So I'm happy to be here today with all of our partners. We thank you for being here to cover this announcement, and I wish I had the giant check to show you, but the check is going into the bank and it's going to go right back out to the kids. I'm going to ask everybody if we could get in front of this lectern here and take a photo together.